I'm just asking you to ensure that your mic is muted. I know from time to time it might be unmuted, so you just got to be mindful of that. Because if you talk when I'm talking, it would disrupt and kind of throw everything off in terms of learning. Right, so this afternoon, I'll be covering urinary incontinence and the Foley catheter. For persons that don't know, I'm Dr. Fiona Perry, one of the doctors that normally would have consults with the telemedicine platform. So, incontinence is the inability to control the flow of urine or feces, right? As it says there, is the inability to control the flow of either urine from the bladder or the escape of feces from the rectum. But today we'll just be focusing on the urinary part. Urinary incontinence is the loss of bladder control. It ranges from occasional urine leakage to complete inability to control urination. And women are twice as likely as men to experience this condition. And you might ask why? Well, we'll get to understand a little more why. But if you think about it, you look at how we're made up and the type of things that we have to do, like childbirth. So that in itself will tell you. Now, this schematic here is basically showing the brain and the spinal cord. These makes up the central nervous system, right? However, when persons have damage, it doesn't matter if it's male or female. If you have any damage or tumor to either the brain or the spinal cord, you can have changes or affectation in the bladder or the urethra, which is part of the renal system, or the sphincter, which is a muscle that actually helps to control urine, right? Um, the changes could be as a result of trauma. The changes could be as a result of tumors. It all depends. But because they have general control, along with another system called the autonomic nervous system, they call causes the changes in the bladder, resulting in incontinence. Symptoms of that, the urinary incontinence, common signs and symptoms of urinary incontinence include leaking urine when coughing. Some of you might or might have not experienced this. If you have a forceful cough, if you're sneezing, laughing, or exercising, especially if you have a lot of accumulation of fat around the abdomen or the tummy area. If you're doing certain exercise and you feel like the urine is escaping, but that could definitely be a sign of incontinence. Feeling sudden uncontrollable urge to urinate, frequent urination, waking up many times at night to urinate, and urinating during the sleep or bedwetting, right? Causes: pregnancy and childbirth. During pregnancy, the uterus presses down on the bladder and this may cause incontinence. Giving birth vaginally can also stretch and weaken the muscles that support bladder control. Menopause. As estrogen level decreases during menopause, vaginal tissue becomes thinner. Experts believe this also happens to the tissue of the urethra, which is where the urine actually comes out. Is a tube that carries the urine from the bladder to the toilet or the commode or the pampers, depending on what is being used. Urinary tract infection also can cause temporary incontinence. Medication, some medications like the diuretics or the water pill for patients that are hypertensive or otherwise. The water pills include like the Lasix or the 8-CTZ. This can cause blood incontinence and nerve damage, as the former or previous schematic would have shown, right? If you have any injury or diseases that affect the nerves controlled in the bladder, this can also cause urinary incontinence. Now, causes can be tumors, it can be anywhere in the urinary tract, constipation, which is the inability or the hardening of the feces or stool, right? Constipation can lead to impacted stool, which places a whole lot of pressure on the bladder because if you're not getting to pass out, right? You're not getting to pass out the feces and that bulk is there and it keep bulking up and it just pushing, it can cause the incontinence. Side effects of hysterectomy, which is the surgical removal of the uterus, can also cause that. Why? Because during the surgery, they might nick or have a little cut so that whether it be the bladder or the urethra, things happen. So that can also cause that. Consumption of excessive diuretics like coffee, tea, and so on. Even these energy drink that lots of persons like to consume, not healthy, right? Those can actually stimulate urine production, causing the urinary incontinence to actually be worse. Types. There are different types of urinary incontinence. They're stress-induced. And with this kind of incontinence, it's characterized by sudden loss of control, like when you sneeze, you laugh, or lift heavy objects, right? The overflow, if the bladder doesn't empty completely and you have issues there, connection with the brain telling um, the bladder that, hey, IDO, we need to empty. So that schematic that I showed with the spinal cord and the brain, if it's not working properly, it can actually cause this to happen because you're not emptying on time, right? So all that could happen. Urge. This type of incontinence is characterized by sudden, severe urge, urinate followed by involuntary urination. Urge incontinence is also more common at night and may lead to getting up multiple times throughout the night to urinate. The functional one is due to inability to make it to the restroom in a very timely manner, right? And mixed. A mixed type of urinary incontinence could be a combination of one, well, two or more. So schematic here is basically showing us the different types of the urinary incontinence. You have stress, incontinence, urge, overflow, and the last one here, the extreme right, is neurogenic. Risk factors. Risk factors for urinary incontinence. You have urinary tract disorder, like urinary incontinence, have a variety of risk factors depending on the specific condition. And these include gender. So women, as was mentioned earlier, women are more likely to develop it in comparison to men because of how our organ is situated or designed. So we have a vagina and we have a very short urethra, right? Whereas men, they have penis and the urethra in the middle, it's longer, right? So anatomically, ours is shorter, so we would have that easier age Menopause and aging can both cause change to the strength of the muscle, right? We know as we get older, negative changes happen for most of us, right? Whether we like it or not, it's just part of getting older. The body weight, having excess weight around the abdomen or the tummy area can put a lot of pressure on the abdomen, causing the urine to leak, right? Smoking, persons that smoke increases the risk of developing many medical conditions, including urinary incontinence. Prevention, like everything else, this could be prevented, right? While you may not be able to prevent all types, the ones that you have control over, you would definitely try your best to ensure that you work on that. So some types of urinary incontinence, since the condition is often caused by something else, such as pregnancy, instead you can reduce your risk of urinary incontinence by avoiding urinary tract infection, learning, and avoiding common triggers like one, maintaining a healthy diet. We could do that. Completing Kegels and other exercises to strengthen your bladder muscles and the pelvic floor. We're going to talk about that later on. Avoiding certain types of foods and beverages that trigger urinary incontinence, such as caffeinated beverages, chocolate, spicy food, acidic food. Quit smoking or don't smoke at all. There is no benefit of smoking. Attending regular appointment with your doctor so that if you notice any changes, you can bring it to their attention and they can help you to, resolve the problem, walk through whatever issues you might be facing. And seeking treatment for urinary tract infection, constipation, and other conditions that might trigger it. Treatment and management. The choice of treatment depends on the type of bladder control problem you may have and how serious it is and what best suits your lifestyle. So one thing we have to learn is that while we have certain basic treatment, not necessarily for urinary incontinence, generally is not a with medicine is not a one size fit all. It all depends on the individual and if they have other factors contributing to this or not. This will determine the best treatment for the individual patient. As a general rule, the simplest and fastest treatment, simplest and safest treatment should be tried first before you go into anything extreme. We learn this in medical school. We go from simple to complex, right? So even with ordering certain things for patients, we go from simple to complex. A combination of treatment also may be helpful for that patient. So when it comes to bladder control training, I mentioned earlier the pelvic muscle exercises, also known as the Kegel exercises, is strengthening the muscles that support the bladder, which can help hold the urine, right, longer and avoiding leaking. So how do we do that? Every time you want to pass urine, you know that you want to pass urine. You're not running to let it go. Shh, all at once. You pass a little, you hold it back or you contract. You let a little out, you contract. You let a little out, you contract or you hold back there. If you don't understand the contraction part, you hold it back. You ain't let all the urine come out. You pee a little, hold back. Pee a little, hold back until it's completed, right? If you do that every day or every time you gotta use the washroom, it's gonna literally help. And even when you don't have to use the washroom, like you're sitting on your chair, you could try it now as we're speaking. Try bear down, hold back. I'm not saying to urinate yourself. You bear down, you hold, you bear down, and so on. If you get in the habit of doing that, it would be easier. Now there is also urgency suppression, which helps control strong urges to urinate so you can make it to the toilet in time. An example of that, you can try distracting yourself, keeping your mind off urinate. Because I don't know if you notice, you want to urinate, yes, and like it ain't coming down, but soon as you near reach the toilet, then you zip in coming down fast enough, and things like that. Next, you don't know what happens, spillage, right? So those are some of the areas that we can work on. Time voiding. It's used to control your bladder through scheduling time to urinate. So if you set a plan like every hour you're gonna go pass some urine, you can do that. Whatever would help you. Now, there's also medical treatments that could be used. Medication that come in pill, liquid or patch may be prescribed to help with bladder control. However, some medications for overacting bladder have been associated with a higher risk of cognitive decline, right? So your brain ain't working properly over the age of 65. So, like some person, not everybody, they have changes in how the brain function, whether this is saying that some of the medication actually clash. So at the end of the day, you have to speak to your healthcare provider and they will come up with a plan that is best suited for you. Vaginal estrogen cream. As we mentioned before, estrogen level decreases with age. So when you go into menopause, you're not getting a lot of that. But sometimes you have to, women want, they can substitute or the unnatural form of estrogen. So they can use cream and there are different other forms of estrogen that can be used to help relieve the urge of distress incontinence, right? You don't have to start high, you start low, and then based on how it progresses or if it's any useful, then you're gonna know if you gotta increase or decrease. Bulking agents can be used to help close the bladder opening. Doctor can inject a bulking gel or a paste that thickens the area around the urethra because remember we said before that you can get thinning or the area can be thin. So this would help thicken it, right? It's just like a piece of paper. Let's liken it to that. If you put water in it after a while or some surface, if you keep adding some moist something, then eventually it tears, right? So this can be done. Also, there are medical devices that can be used to manage urinary incontinence, such as a catheter that drains from your bladder straight into the bath. And some of you would have had to insert one of that for patients, especially males. Most cases that I would have had to guide CHWs to do it would have been male patients that aren't getting to void or empty the bladder as they should or as they would like to.
It's not showing that updated. The screen is not showing.
Biofeedback. Use a sensor to make aware of the signals from your body, and this may help to regain control over the muscles in your bladder and the urethra, right? Electrical nerve stimulation is another one that sends mild electrical currents to the nerves around the bladder that help control urination and your bladder reflexes. Surgery. We would have spoken about the simple, now this is a little more complex. Surgery can sometimes improve or cure incontinence if it is caused by a change in the position of the bladder or a blockage in cases where men have enlarged prostate, right? There is also behavioral and lifestyle changes that we could adapt so as to avoid urinary incontinence, right? Losing weight, don't consume alcohol, don't smoke, avoid being constipated. So you gotta work on, it's all about what you eat and what you drink. So that has a lot to do on not only urinary incontinence, but a lot of other diseases that persons might face. Now, I put this as chief complaint because sometimes patients might come referring needing to urinate more frequent or suddenly. They might say that when they pass urine, they have cloudy urine, or sometimes they have blood in the urine. It might not be frank blood or bright red blood, but they notice some streaks or when they pass urine and they wipe, they see blood, and not women only, male too. Urinating 8 or more times in one day, passing only small amounts of urine after strong urge. Like, you want to urinate, but then when you go barely a few drops of urine, or trouble starting or having a weak stream while urinating, right? If a patient comes to you with a few or any one of these complaints, this is a question to you. What would be one of the first things that you suspect is happening to the patient? Anybody want to give a try? You could unmute and answer. What do you think might be happening here to this patient?
Patient get a urinary tract infection.
Correct. Very good. Very good. A urinary tract infection. So these are just some of the things that, we pay attention to. Thank you very much, Patricia. Now, we spoke about incontinence. We mentioned urinary tract infection. Now we're gonna touch a little on your Foley catheter. A Foley catheter is a medical device used to drain urine from the bladder when someone is unable to or they have difficulty urinating. Some of you, if not all, would have seen what it looks like. It's a semi-flexible tube that is inserted through the urethra, whether it be male that have a longer one or a female that have a short urethra. It must be passed through the urethra, right, and left in place to continuously drain the urine. However, as we learn going forward, that urine is not the only thing that comes out from there. A healthcare provider may recommend a Foley catheter for a number of reasons, including urinary incontinence, we just covered when somebody is unable to control when they urinate or leaks urine. Urinary retention, meaning that the urine is not able to pass out, or the amount that given the amount of fluids that they would have intake, the amount of urine that's supposed to pass out is not passing out, or surgery, before, during, or after surgery, and the genitals, prostate, womb, ovaries, or bowels, right? It's important to know that. Now, anesthesia and medication. After taking medication, or if you have to do surgery, you can't move, right? Some of these medication have persons really drowsy, so we don't allow persons to. Sometimes they're still sedated. So you pass the Foley's so that you can get urine out. Apart from that, with the Foley's now and the urine passing in the back, it helps to measure in cases where persons have heart issues and so on. You're measuring the input and the output, how many fluids the patient received versus how much of the fluid they were able to excrete. That would tell you also if the kidneys working fine, right? Other medical conditions such as dementia, multiple sclerosis, or spinal cord injury, right? Dementia when persons don't remember, for want of a better term. Multiple sclerosis when they have the muscles, they're losing control of the muscles, so everything just there. And the spinal cord, well, you saw what the spinal cord looks like. If there's any trauma or tumor or so on, can cause that, right? Bladder weakness or nerve damage, same thing. Childbirth, when a woman is having a C-section and they have to do epidural, they put in the anesthesia in the spinal cord back there and they can't move, so they have to put a urinary bag, so they pass the Foley's to connect to there. Also, if they have obstructions, when there's an obstruction in the urethra, or they have like scarring, or they have enlarged prostate. That makes it difficult for urine to pass, right? A Foley catheter can also be used for hemorrhage control, such as in the case of trauma or nosebleeds, right? But we're not focusing on that. Now they have different sizes that the Foley catheter comes in, right? It ranges typically from 16 to 26 French. So this is how it's referred, French. So if you see the number on FR, you know the FR means French, right? And they give you the most common adult size, excuse me, 14 to 18. Doesn't mean that they don't use any other, right? It's the most common adult size. Now, in order to determine the appropriate Foley size, you must consider the patient's age, gender, aiming for the smallest one, right? Even for the smallest one, bigger doesn't always mean better. So for adults, typical size is 10 to 12 for women, right? And 14 to 16 for men. While in children, they might be using typically 6 to 10. A larger size, 16 to 20 French, may be necessary for patients with blood clots, debris, hematuria, and all of that, right? As a form of post-irrigation, or meaning getting rid of the waste from the bladder. General sizing guidelines. The French gauge is universal system for measuring catheter size. A larger French number is larger in diameter of the catheter. For instance, 1 French is equivalent to 0.33 mm, right? Children's size vary by age, generally, like I said, 6 to 10 French. A pediatric patient size may be based on body weight and height also. So we have some children that yes, they might be 6 years old, but they a little bigger in size compared to like a regular 6-year-old. So the size of catheter might be varying a little bit. And for the adults, women typically 10 to 12, men typically 14 to 16. Now, consideration for specific conditions, blood clot, debris, hematuria. You might need a larger one so that you could get, do all of that, get rid of. It's like you see particles and you want to clear that area, right? So you just drain it out. You flush it out with the normal saline, and you're gonna see how you do it in the upcoming slides. You have the two-way versus the three-way. When to use it and why. Right, the choice depends on the patient's need because the two-way catheter are standard in dwelling use, and the three-way catheters are specific for procedures like prostate surgery, where irrigation is required to clear the bladder. When you pull out, when you're looking at the Foleys again, you're gonna see the two part is the two-way, right? So you set it in place if you want. So a male patient comes and they have urine retention because they come complaining of not being able to pass urine. The belly is hurting or the abdomen is painful. They get in fever and things like that. You know to yourself that, hey, this person probably has an enlarged prostate and needs to drain. So you sterilize the area, you pass the Foley's, right? And then you see the urine starts to come out. Good. So this is where the two-way gonna be necessary, right? But when you push in, remember to keep it in place. You always gotta use the other part to put in the normal saline to expand the balloon so that the Foley's could be in place. And the three-way or no way. A three-way Foley catheter is used to provide continuous blood irrigation, often following surgery to prevent clot formation, or clear the blood clots or debris or other obstruction that might be in the bladder. So the channels, drainage lumen, it drains the urine. The balloon lumen is to infiltrate or inflate and deflate rather the balloon, because like I said just now, you pass it so that it can expand. And when you're taking out the Foley's, you're not pulling, you have to take out the solution. In most cases, we use normal saline to hold that Foley's in place, and you have to take out, if you know you put 5 mils, ensure you get back the 5 mil before you take out or retrieve the Foley's, because if you just pull it or yank it out from the patient, it definitely can cause tears, and then you send the person to the hospital to do surgery, right? So you gotta be careful. And the usage for the three-way typically use transurethral resection of the prostate or other urological procedures that carry the risk of bleeding, right? So it's important to know when to use what. And the size and the color of the urethra, the Foley's. So they're showing the different colors, and you almost look at the ones that you all have there, right? They're gonna show you the color, and based on the color, you can see the size. So this is basically for information purposes. And just an example for persons that never saw Foley's before. This is what it looks like, right? It gives you why they put female based on the numbering that used for female and pediatric ones. I'm showing you a two-way and a three-way. And when you insert the sorry, when you insert the fluid, the normal saline, to expand the balloon, remember this here is just to keep it or hold it in place. All right? So you put it through here. It expands here to keep it in place. And when it's in the urinary bladder, the urine pass through here, go, come out here into the urine bag, right? So this is how it works. And this for the two-way. And for the three-way, you hold it in place. You flush in one with normal saline, it's gonna pass through here, and it's gonna come out. You can see all the blood clots and so on through the next one. So this is why it's important to know when to use which two-way versus three-way. So you have a general idea of how it is used, why it is used, when it is used. So in conclusion, urinary incontinence is a health condition that needs to be addressed. Please mute. Please mute. Urinary incontinence is a health condition that needs to be addressed at the earliest time possible in order to identify a particular health condition, reduce other health crisis and embarrassment. In choosing the most appropriate size of Foley's, always remember that you have to select the smallest, right, to ensure sufficient drainage. To ensure comfort and safety, the catheter should not be too large, as this can cause discomfort and even urethral tears. I can't remember which health post it was. By the time they had to pass a Foley's for patient, and it caused a bit of trauma to the patient, right? Because it was a little too big, and the patient said he wanted it out, and then when he passed in the urine after, he's seeing bloody urine because of the trauma, right? So this is why it's very important to know what size to use. I can't tell you what size unless I'm in front of the patient, but you would have to use wisdom and discernment in order to choose which would be best. You know, generally based on the charting, which one might be most appropriate for male So you start small, and then if you need to go a little larger, then you do that. You got to be careful. You got to be mindful because at the end of the day, you want to help your patient. And if you're going to cause so much trauma that they don't want to use it, well, we don't want that. We want to help them, right? So this brings me to the end of the presentation. Thank you for your attention. Any questions? Any questions? Yes, no?
No.
Okay. Thank you. And I think it was a good session.